Who's inside are the CEO and I'm sure a lot of donators and benefactors of the hospital, managers, I'm sure, and directors, physicians, people who are employed by the hospital, certainly not us employees. I've been involved in this campaign. This will be my 4th year now, and actually this is the 4th year of the campaign. I got involved in this campaign as well as many hundreds of other nurses because we noticed that when Resurrection Healthcare came and took our hospital over, which was West Suburban Hospital in Oak Park, that things really started to change. And the thing that affected us most was that we felt that the quality care that we were able to give our patients was being compromised. 650 nurses from all the res hospitals had signed letters addressed to Mr. Joseph Toomey asking him to sit down and dialogue with us, and they weren't willing to do that. They're not willing to do that now. We enlisted the help of AFSCME to help us in our campaign, and we felt that by organizing and forming a union with AFSCME that we would be able to sit down and negotiate with Resurrection Hospital to make the important changes that we felt are needed at the hospital. In my department, probably 20%, 25% of the nurses that I work with have been there 10 years and above. The interesting thing about that statistic is there's a core group of us that stay there and who have stayed there because we love our community. We consider this hospital a jewel in our community because we serve really 2 areas of population. We work with a lot of clients from the west side of Chicago, which are the poor and underserved, and we also work with people from Oak Park River Forest. So as far as patients, it's very demographically diverse. Now, the turnover for nurses in my hospital is another issue that it raises a big concern. We have had a huge turnover, especially in our department. In the last 2 years, 25 employees have left. And a lot of employees have left because they feel like staffing is unsafe there, and that's what we're fighting right now today. We're doing it in Springfield as well as this protest here today. The same things come up over and over again, and you hear it universally. And the things that you hear is, if there's a union, the hospital will close. The employees don't want the union. And there's various intimidation tactics that they use. My own experience was, for 12 years I was a role model employee. When I started getting involved in the union, everything changed. And it's not overt. It's I like to call it death by 1,000 cuts. It's day-to-day, month-to-month kind of changes that occur. You no longer get role model status. You're not asked to be a part of any committees. You're taken out of areas that you were once considered a leader in. So it's these little things that they do. And here's another example. A patient care technician had a green AFSCME pen and was working at a desk in my unit, and the manager came up to her and asked her where she got the pen and did she know what the pen was. And the employee responded, well, yeah, I know what this pen is. And my manager said that she was very disappointed in her. So it's that kind of intimidation that employees feel, and the employer has all the power. They are the ones that control your schedule, your paycheck. So if you disappoint them, how can you feel confident and comfortable that you can talk to your employees about organizing and unionizing when you have someone who's in control over your job and livelihood telling you that they're disappointed? So it's very unfair. And I feel that it's the fear and the intimidation that these little incidences create that prevent people from coming together. More and more people, though, are coming out and saying that our work conditions are unacceptable and we need to learn more about the union. And how I feel about it is this: let the employees decide by a fair process. Right now the process isn't fair. In my mind, the well is poisoned already. You have employer intimidation. They can call you in for one-to-one meetings. But they do not allow any union material to be circulated. They do not allow people from the union to come in and talk. So it's very one-sided. So how can people make a fair decision? In my mind, you can't.
What would you say to the television audience about how the union at Resurrection Hospital would improve services or improve health care?
Well, you're bringing the people who are at the front lines, the nurses, the employees who are doing the day-to-day work, to the bargaining table, where you are able to talk about how to improve patient care, how to improve working conditions. In my mind, anytime you include an employee in this kind of decision-making process, it's a win-win situation.
What's disgusting? Union busting! Disgusting! Union busting! That's disgusting! Union busting! Union busting! Union busting!